Next, we'll discuss the preoperative, postoperative, and long-term care of a client undergoing ostomy surgery. An ostomy is a surgical opening made through the abdomen into the colon or the ileum for the excretion of wastes. Ostomies can be temporary or permanent. The location of the ostomy within the intestine determines the consistency of the excreted stool. The stool is excreted through a stoma, which is an artificial opening on the exterior surface of the abdomen. What are the indications for ostomy surgery? Small bowel obstruction, large bowel obstruction, colon cancer, inflammatory bowel disease due to ulcerative colitis or regional enteritis, abdominal trauma, and compromised blood supply to the intestine. Diagnostic tests performed prior to ostomy surgery include flat and upright abdominal x-rays, colonoscopy, MRI, CT scan, and ultrasound. The client may undergo a barium enema, provided bowel obstruction is not suspected. The goals of ostomy surgery are to relieve the obstruction, reduce inflammation, remove the tumor, restore bowel function, and prevent complications such as stoma necrosis, peritonitis, and infection. During colostomy surgery, the surgeon makes an incision in the abdominal wall and pulls a loop of the colon, or the severed end of the colon, through the incision, where it's shaped into an artificial opening called a stoma. A colostomy allows feces to be expelled into the colostomy bag or pouch attached to the skin around the stoma. A permanent colostomy involves the removal of the rectum, anus, or distal portion of the bowel. A colostomy is temporary when the rectum and the anus are left intact and reanastomosis is possible. During ileostomy surgery, the surgeon removes the colon and the rectum and then pulls the ileum, which is the lower part of the small intestine, through an incision made in the abdominal wall. An artificial outlet is created to allow the bowel to expel feces through the stoma in a bag attached to the skin. As a rule, the stoma is placed on the client's right side around 2 inches, that's 5 centimeters below the waist and away from the hip bone. An ileostomy is usually permanent. What are the nursing diagnoses for clients undergoing ostomy surgery? Body image disturbance related to the presence of the stoma and odor. Grief related to the loss of control of body elimination. Pain related to the surgical incision. Risk for impaired skin integrity related to chemical irritation from bowel contents or improper fitting of the pouch. Risk for diarrhea related to interruption or alteration of normal bowel function. Risk for constipation related to interruption or alteration of normal bowel function. Altered nutrition, less than body requirements related to decreased appetite and inability to tolerate some foods. Risk for deficient fluid volume related to diarrhea. Impaired social interaction related to fear of embarrassment caused by altered bowel control and/or odor. And sexual dysfunction related to altered body structure, function, and image. Here are a few questions about clients who have had an ileostomy or colostomy. Which client is required to wear a bag or an ostomy appliance? The client with an ileostomy, because it's higher up in the bowel and therefore there is continuous leakage of liquid. Some colostomy clients do not need to wear a bag once they've learned to irrigate the bowel and have a bowel movement once a day. Which client is at greatest risk for fluid and electrolyte imbalance? The client with the ileostomy, because it's in the small intestine. Which client can bathe or swim? The client with the colostomy. There's too great a risk of infection for an ileostomy client. There is also a chance that a client wearing an ostomy bag could infect the pool. Which client will worry most about embarrassing odors? The client with an ileostomy, because it's high in the bowel and not everything is digested. Which client is at greatest risk for skin irritation? The client with the ileostomy, because the digestive juices are right there and can be irritating to the skin. During the preoperative period, it's important to provide emotional support to the client and family. It's helpful to have the client visit with a person who has successfully undergone ostomy surgery. The United Ostomy Association provides trained visitors who can encourage the client. In addition to routine preoperative preparation and teaching, the nurse, ideally a stoma care nurse clinician, assesses the client's ability to care for the stoma. The nurse also evaluates the client's available support systems, as well as any problem that the client and family may encounter following the surgery. To prevent postoperative infection, the client's bowel is prepared prior to surgery. Erythromycin, neomycin, and osmotic lavages are administered orally to cleanse the bowel of feces and bacteria. In addition to standard postoperative measures, the nurse assesses and cares for the stoma, protects the skin around the stoma, and ensures proper fit of the pouch or ostomy appliance around the stoma. Also, be sure to instruct the client in ostomy care and diet modifications and provide emotional support. The overall goals for a client who has undergone ostomy surgery are to become self-sufficient in caring for the stoma and pouch, to regain independence, and to improve self-image. It's important to assess the client's mental attitude toward the stoma and self-care before beginning instruction. You should not force a client to look at the stoma or perform self-care procedures until he indicates that he's ready. To help the client achieve self-sufficiency following stomal surgery, be sure to provide clear instructions. Demonstrate care of the stoma, basic pouch care, and colostomy irrigation as appropriate. Discuss dietary modifications, how to order supplies, and community resources. Prior to discharge following ostomy surgery, provide the client with the following instructions. Inspect and clean the stoma and empty the pouch daily. Store stoma care equipment in the container in the bathroom. Equipment includes a pouch, scissors, tissue, soap, towel, washcloth, and a bag for disposal. Because a stoma will decrease in size over the first year, measure it 3 to 4 times a year to make sure that the pouch fits properly. Thoroughly wash hands prior to and after changing the stoma appliance or pouch. Inspect the stoma and skin around the stoma carefully. Look for signs of bleeding, irritation, skin breakdown, swelling, and redness. Report these problems to the primary care physician. Empty the pouch into the toilet when it's 1/3 full and rinse it with clear, cool water. It's usually necessary to empty the pouch about every 5 hours. Clean the area around the stoma with non-irritating soap and gently pat it dry. Apply a skin barrier such as a liquid or spray skin sealant. Once the sealant is applied, place the pouch over the stoma and press it down on the skin for a few minutes for a good seal. Change the pouch about every 5 days. Report constipation or diarrhea to the primary care provider. Eat a regular diet but avoid gas-forming foods and drinks. Gradually add foods containing fiber to the diet. Which food should a client avoid to prevent obstruction? Following an ileostomy, the client should avoid nuts, raisins, popcorn, seeds, raw vegetables, celery, and corn because they can cause obstruction. Assume regular activities within 6 to 8 weeks, but avoid heavy lifting. Which client might have more difficulty with sexual relations? The client with an ileostomy because a bag is right in front. The client may also be embarrassed about its odors. It's important to discuss and educate the client about potential sexual feelings and activities. Supply a contact such as a United Ostomy Association for additional information and support.